What we know now about diabetes is that diabetes is really just more than just blood sugar elevation and managing that part of their condition, that it's really a whole constellation of issues. And I think what we learned is that we're going to have to address that with each patient on an individual level, so that the discussion about management goes beyond just adherence to drugs and to proper eating, etc. It becomes, what does all of this mean for me in my life, and how can I express my goals to my care team to really understand, make goals realistic, and have ongoing feedback as to how I'm doing. So I think that we are beginning to understand that the personalized nature of the condition requires a personalized approach. And I think we're in an early learning period for that, because there's so much about diabetes, type 2 diabetes and multimorbidity, that we don't really understand. We're still trying to apply old conceptualizations of the condition. But I think there's more to this epidemic and pandemic than we really understand. And the first step to getting to that understanding and the wisdom of it is to be able to look at each patient as their own story. They have their own phenotype, and they need to understand that as well. Many people have had diabetes for 10 or 15 years and have been diagnosed and managed and never understood any of that. And I think largely because we as providers historically haven't really thought in terms of the comprehensive nature of diabetes, and our care system hasn't supported that kind of care delivery model. So we now understand we've got to change the way care is delivered. And the toughest challenge is those people who have conditions that are not curable, but are progressive, that have an interplay between other comorbidities and multimorbidities, and that all of that is very complicated. So I think that's what's empowering a lot of our thinking now, and why we're going through disruptive innovations.